Hello, students. Welcome back to Next Level Academy Step Up Your Career. Today, we are going to see the part 3 of the JIPMER skill test conducted on January. First is Langer mask airway. The Langer mask airway LMA was kept in front of the candidate, and the candidate has to identify. Let's today see this Langer mask airway quite brief. I know you know the parts of the Langer mask airway. Let me just explain you. The parts are curved, and this is the airway tube through the where the oxygen is actually um, delivered to the patient, and this is the connector where the ambu bag is connected, and this is the balloon where you can confirm it whether the cuff is inflated or deflated, and this is the valve where you connect the syringe to inflate and deflate the cuff. And first thing is like when you going to start up a procedure, as you know that you have to wash your hands and you have to wear your glove, and the gel actually has to be applied the backside of the cuff. It has to be spread all over, and you have to keep the index finger for the easy guidance for the guidance, and you have to insert it in such a way that it has to be introduced behind the tongue with the backward pressure using the index finger and passing the device of the hard palate. Okay, this is the hard palate. You will insert it completely, and actually this will sit in the hypopharynx of the patient, and where the airway tract is easily ventilated through it, and the the inflation line will be uh, taken in the another holded in the another hand, and it has to be inflated. So you will come to know through the balloon whether it is inflated or not. Okay, and this size of the laryngeal mask airway it will come around like 1 to 5. So it depends upon the weight of the patient. You will choose it. We'll go to the I forgot to tell you before the procedure. Okay, the patient's head has to be extended so that it will be easy to insert it. Next. Next is intercostal drainage, ICD. This was also kept in front of the candidate, and the candidate has to identify it. Today we will see a brief about the ICD. So the purpose of the intercostal drainage tube is nothing but to drain the air or fluid from the pleural cavity. For the purpose is to lung re-expansion. So this it is inserted in two sides. One is anterior and another one is lateral. The anterior chest tube, it is actually inserted. The landmark is second intercostal space in the mid clavicular. Okay, the mid clavicular, and the lateral chest tubes it is inserted in between the mid axillary line here, the mid axillary line, and at the level of the fifth intercostal space. So this is where it is inserted and it's lodged. And in Indian scenario, so there'll not be a jar like this. It's actually a bag. So this bag will be filled with the saline. Okay, it'll be filled with 100 ml saline solution, and there'll be a marking. Okay, till where you have to fill it, and the it'll be a sealed bottle and sealed bag. So the chest drain will be inserted. So this should not get exposed to the air. This should be under the water at the end of the tubing. And when the patient inspires, when the patient inspires secretions, or sorry, fluid, or no, this will um, move up and down. So if it will move up when the patient expires, this will move down. So that then you will come to know that this is working. And on the day one, uh, within in 24 hours, so you can see the blood will be oozing. Okay, so that's actually normal. And later on, the secretions, suppose if it is excess, okay, you have to inform the doctor. And the how much the saline you are filling it. Okay, you have to mark it. And suppose if it's like 100 ml you have filled, and In 24 hours, it has come up to uh, 300 ml. So which means 100 minus 300, 300 minus 100 is 200. Okay, so 200 is the fluid it has been executed. So that you have to mark it. So it's just a brief I'm explaining to you. Next is GTPAL. GTPAL is nothing but an obstetrical score. You can calculate it easily. Uh, First is G. Means gravida or gravidity, which means number of pregnancies. And T is full term pregnancies, 37 to in between 37 to 40 weeks. And P is preterm births before 20 to 36 weeks, which is not a full term. And the A is abortion or miscarriages is before 20 weeks, which is called maternal termination of pregnancy, MTP. You might have studied. Next is L is current living child. How many childs the mother is already having now currently? Okay, let's move on to a question. So I hope you'll easily find out. A 27 years old female is currently 16 weeks pregnant. She has 2-year-old twins that were born at 39 weeks gestation and a 5-year-old who was born at 40 weeks gestation. She had no history of miscarriage or abortion. What is a GTPAL? So let's sort it out. Let's find out the answer. First, is they have asked 27-year-old female is currently 16 weeks pregnant. Okay, so now she is actually pregnant. Okay, she has already 2-year-old twins that were born at 39 weeks of gestation. So she's having already old twin. So already here also she got pregnant. Here also she's pregnant. So one, two. Next is and 5-year-old was born at 40 weeks gestation. So three, third time pregnancy, and she had no history of miscarriage. So actually to say like this is one, okay. Second, twins, and this is the third pregnancy. Okay. So already now, so the gravida is three. Number of pregnancies are three. And next for term. So as we discussed, okay, 39 weeks and 40 weeks are term. So this term pregnancies are two. She had no history of miscarriage or abortion. So miscarriage and abortions are no. And is there any preterm pregnancy? No. It's all beyond the 37 weeks. So zero. And how many live children's? So she has 2-year-old twins. Okay, 2-year-old twins. So two child over here and 5-year-old child. So three, three live. Let's see the answer. 32003. The answer is D. Let's sort out another question. So the next question is a 30-year-old female is 25 weeks pregnant with twins. She has five living children. Four of them, four of five children were born at 39 weeks gestation and one child was born at 27 weeks gestation. 2 years ago, she had a miscarriage at 10 weeks gestation. What is a GTPAL? Okay, please, students, I expect your comments. I hope you will answer for this question by your own. Let me see. We shall move on to the. So, students, I hope you would have understood everything. And please like, share, subscribe. And I'm waiting for your comment, your answer. Okay, we'll meet in the next class. Thank you.